One of my favorite techniques that arose from working in physical health settings is about the idea of arriving properly in a difficult conversation. Okay, we all find ourselves having really tricky conversations. And a lot of my work has been with my doctor and nurse colleagues who've had to go into a situation and break bad news, say, but also anybody in a therapist role may well have some consultations that they're really not looking forward to and they know are going to be really hard to have. But it's not just us as therapists and healthcare professionals, right? This is also for anyone who is going to have to kind of prepare themselves for breaking some bad news to somebody or confronting a tricky issue. One of the problems is we're often already in the situation before we've really thought our way into it. And we get kind of tripped up, or we're really apprehensive, and something that's going to help a person settle and arrive properly in the best possible preparation for having a tricky conversation means it's just more likely to go well. So what is this technique? I think of it as simply as just how to arrive. And there's kind of like 4 steps to it. So if we were doing it now, I'd be encouraging you to do this, first of all, to come into the present moment. Okay, how would I get you to do that? I'd get you to look around the room and find one thing that you can see. Listen and see one thing you can hear. Maybe feel the ground under your feet. Maybe feel the passage of one breath. Okay, so just from all the mind being stuck in the past and the future, bring it right into I am here right now. That's step 1, come into the present moment. Step 2 is set your intention. Okay, what do I mean by that? I mean, what do I plan to do here? We could call that a behavioural intention. And what outcome am I aiming for? So that's our intended outcome. So just remind yourself of what it is you're about to do and what feels like the outcome you would want, what feels like a win. The third step is connecting to your values. Okay, so what we do here is we remind ourselves, why does this matter to me? Why does it matter to do this? Why does it matter to get this outcome? And also, how do I want to act in this situation? What do I want to bring to the situation to be kind of true to myself and true to my values? So connecting to your values about both trying to do this tricky conversation and trying to do it well and trying to get the kind of outcome you're aiming for. Connect to your values. And if we just left it at that, it would be kind of similar to lots of motivational approaches that you hear around. Here's the 4th step that I think is really important. Engage willingness. Okay, recognize that doing this thing is going to bring up difficult thoughts, difficult feelings. We're going to feel uncomfortable in doing it because we give a damn. The danger is we sometimes have this rule that says, if I feel bad, this must be going wrong. Very often when it comes to having a difficult conversation with people, feeling bad is part of doing it right, is part of being willing to walk towards the thing that's difficult. So engaging a willingness to have difficult thoughts and feelings, if that's what it takes to do this thing and to do it well, to get the sort of outcome that you're hoping for, because it matters, because of the values that we've said. Now, I've just sort of talked through that. It takes a little longer to talk through it than to do it. But realistically, we can do this kind of thing in 20 seconds. We can spend 5 seconds looking around, listening, coming into our bodies, coming into our breath. We can take 5 seconds reminding ourselves what it is I'm about to do, why it matters to me. We can take 5 seconds reminding ourselves, why does this matter? Who do I want to be? How do I want to act? And then 5 seconds saying, what's likely to show up for me in this? I'm going to feel awkward. I'm going to feel sad. I'm going to worry that I've upset a person. Am I willing to have that if that's what it takes to do this thing? Right. And then we walk into the situation. So that's how to arrive.